Let's discuss face reading uterine fibroids. Uterine fibroids are benign tumors in the female genitalia that are manifested as an enlarged uterus or in abnormal menstruation. Uterine fibroids are composed of smooth muscles and connective tissues. The condition is more common in middle-aged women. Clinically, the main symptoms of uterine fibroids is masses, which may lead to uterine bleeding and abdominal fullness or pain, abnormal leukorrhea, anemia, infertility, and miscarriages. Western medicine believes that uterine fibroids may be related to long-term high levels of estrogen in the body, whereas TCM holds that uterine fibroids are related to coagulated cold in uterus, stagnation of chi and blood stasis, and dysfunction of the spleen's transportation. Face reading. Women who have dark hook or spiral blood vessels in the outer cantal triangle of the eye are prone to uterine fibroids. Women with one or multiple dark red blood vessels under the outer contour of the eye may have uterine fibroids. So here is an illustration of a dark hook or spiral blood vessels in the outer cantal triangle of the eye and dark red blood vessels under the outer contour of the eye. Therapeutic methods, uterine fibroids are not easy to detect, so diligent observation is required. Watch out for any abnormalities and go to the doctor for checkups. In daily life, you can take some preventive measures. Frequently pressing and kneading the lower abdomen can promote blood circulation, resolve stasis, and alleviate symptoms of fibroids. Dietary advice: consume a light diet. It is not advisable to eat foods such as chicken and crabs, which may trigger the disease. Be cautious with foods or health products that contain estrogen. Exercise. Patients with uterine fibroids should be actively engaged in exercise to improve their physical fitness. Aerobic exercise such as running, swimming, and yoga are good options. Emotional adjustment. Avoid losing your temper during menstruation, which can lead to stagnation of chi and leave you prone to uterine fibroids. It is important to be relaxed and positive to prevent the formation of fibroids. Moxibustion. Apply to the Gu, Guan, Shi, Gong, and Shan Yin Yao to invigorate qi and promote blood circulation, eliminate phlegm, and dissolve blood stasis. Apply mild warm moxibustion to these acupoints once daily, 15 minutes each time until a warm, comfortable sensation is produced on the skin. Thank you for your attention.
Interviewing. When emotions become causes of disease. Emotions. Emotions are mental stimuli which influence our affective life. Under normal circumstances, they are not a cause of disease. Indeed, emotions should be more appropriately called feelings, and feelings are a natural expression of human life. Without feelings, we would not be human. Hardly any human being can avoid being angry, sad, aggrieved, worried, or afraid at some time in his or her life. For example, the death of a relative provokes a very natural feeling of grief. It is only when such feelings take over a life inappropriately and disturb our psyche and body that they become pathological. When this happens, feelings have turned into moods. Moods often arise precisely when feelings are suppressed. For example, if a certain situation makes us angry and we recognize the anger, we can deal with it and perhaps even come to the conclusion that part of the anger was a projection of our own shadow. In such cases, the anger is a normal feeling that will probably not have pathological consequences. But if we fail to recognize our anger, this will be driven to deeper levels of our psyche and turn into a mood that possesses us. We possess feelings, but moods possess us. Thus, emotions or feelings become causes of disease only when they are excessive, prolonged, suppressed, or unrecognized, in which case they turn into moods. For example, hardly anyone can avoid being angry sometimes, but a temporary state of anger does not lead to disease. However, if a person is constantly angry about a certain situation in life for many years, or even worse, if the anger is not recognized, this emotion will definitely disturb the mind and spirit and cause disease. In Chinese medicine, emotions, the term here signifies causes of disease, not as normal feelings, are mental stimuli which disturb the mind and spirit, and through these alter the balance of the internal organs and the harmony of qi and blood. For this reason, emotional stress is an internal cause of disease which injures the internal organs directly. On the other hand, and this is a very important feature of Chinese medicine, the state of the internal organs affect our emotional state. For example, if liver yin is deficient, perhaps from dietary factors, and causes liver yang to rise, this may result in a person becoming irritable all the time. Conversely, if a person is constantly angry about a certain situation or with a particular person, this may cause liver yang to rise. Thank you for your attention.
Let's now proceed to the acupuncture point Shou Wu Li, or the arm 5 miles of the Han Liangming large intestine meridian. Li13, or Shou Wu Li, is located on the lateral aspect of the arm, 3 chun proximal to the elbow crease. The Ling Shu states that needling arm 5 Li damages the qi of the 5 viscera, or zang. Other texts indicate it is used for pain along the large intestine meridian affecting the elbow and or shoulder, for difficulty raising the arm, and for cough. It is not used as frequently as Li4 for pain affecting the shoulder and the upper arm. This point is used for elbow pain along the Li channel, for distension and pain below the heart, for fear and fright, for cough, pneumonia, blurred vision, and peritonitis. This point is indicated for pain, numbness, or contraction of the elbow and upper arm, for inability to raise the arm, shoulder pain, wind taxation with fear and fright. It is also for cough, difficulty in breathing, and vomiting blood. It is also for scrofula, desire to sleep, diminished qi, inability to move the forelimbs, yellow body with intermittent low-grade fever, malaria, blurred vision, fullness, and distension below the heart, for fear and fright. This point is used in combinations with other points. For scrofula, Li13 is used with Li14 according to the 100 symptoms. For scrofula, we can use moxa on Li13 and stomach 9 according to the 1,000 Ducat formulas. Thank you for your attention.
Let's discuss heart pattern, heart blood deficiency. Concept: pattern caused by deficiency of heart blood failing to nourish the heart. Clinical manifestation: palpitation, insomnia, and dream-disturbed sleep, dizziness, poor memory, withered yellow or pale complexion, pale lips and nails, pale tongue, a ready and weak pulse. Analysis: this pattern is usually caused by spleen deficiency failing to produce blood, or severe hemorrhage or chronic diseases impairing blood, or prolonged anxiety and worry consuming the blood. Palpitations, insomnia accompanied by symptoms of blood deficiency. Analysis of heart blood deficiency. Deficiency of heart blood, failure in nourishing the mind, results to palpitation. blood failing to nourish the heart, disturbing the mind. So there is insomnia and dream-disturbed sleep. Blood failing to nourish the head, face, and tongue. There is dizziness, poor memory, withered yellowish or pale complexion, pale lips and tongue. Insufficient blood failing to fill the vessels. So there is a thready and weak pulse. Hard blood deficiency etiology, diet lacking in blood-producing foods, prolonged anxiety and worry, heavy bleeding. Underlying or accompanying pathology, spleen Chi deficiency, heart Chi deficiency, heart yin deficiency, liver blood or yin deficiency, nutritional disturbance, neurosis, tachycardia, arrhythmia, anemia, hyperthyroidism. Signs and symptoms, palpitation, dizziness, insomnia, dream-disturbed sleep, anxiety, poor memory, easily startled, dull complexion, pale lips. Pulse is fine or choppy, tongue is pale and thin. Treatment principle is to nourish heart blood and calm the shunt. For the acupuncture treatment, Heart 7 supplements the heart blood, calms the mind. REN 14 supplements the heart blood, calms the mind. REN 4 supplements the blood. Bladder 17, gathering point for blood. Bladder 15 boosts heart chi and calms the shen. PC 6 supplements heart chi and pacifies the mind. REN 15 supplements heart blood, calms the shen. Bladder 20 supplements spleen to produce blood. Spleen 6 supplements blood. Relevant advice when there is heart blood deficiency, it is important to eat a diet that nourishes the blood. Things that nourish blood include green leafy vegetables, beetroot, seaweeds, dates, kidney beans, black beans, aduki beans, red meat, bone marrow, blood, sausages, heart, and liver. The patient should avoid sugar, stimulants such as coffee, and too much alcohol. Nettle tea will be beneficial for them to drink. The patient should not only eat a diet that is rich in blood nutritious foods, but they should also eat a diet that is beneficial for their spleen chi. This means eating warm, prepared foods such as soups, stews, baked vegetables, and so on, and avoiding salads, raw food and beverages that have cold energy or produce dampness. The advice given in the section on heart yin deficiency will also be relevant here. Thank you for your attention.
Let us now go to pulse taking. The topic is firm pulse, also known as confined pulse. The firm pulse has these features: deep, taut, long, large, and forceful. It can be palpated only by pressing. The clinical significance of a firm pulse signifies accumulation of yin cold and submergence of yang qi. It can be seen in hernia, abdominal tumor, or any severe pain. Clinically, it also occurs in hardening of the arteries and chronic nephritis. The analysis is when yin cold accumulates in the interior, yang qi submerges and meridian qi hides. Hence, the pulse is deep and its pulsation strong, large, and long. In chronic nephritis or hardening of the arteries, the elasticity of the blood vessels is diminished but the lumen is full. This raises the blood pressure, hence a firm pulse. The firm pulse is opposite to the leather pulse. The leather pulse feels floating, wiry, and hollow, whereas the firm pulse feels very deep, strong, long, and slightly wiry. The leather pulse appears with symptoms of extreme deficiency, whereas the firm pulse appears with symptoms of extreme excess. In summary, the firm pulse has the characteristics of deep, slightly taut, long, large, and forceful. The analysis is accumulation of yin cold with submergence of yang qi, sinking of qi in blood, and its clinical significance is accumulation of yin cold, submergence of yang qi, where there's pain, hernia, or abdominal tumors. Thank you so much for your attention.
Let's discuss diagnosis according to Zanko organ patterns with a pattern ascending liver yang. Liver qi is very yang and is dynamic and therefore already has a tendency to ascend. If there is a deficiency of yin or an excess of yang upwards, yang qi has an expansive nature. This means that symptoms of ascending liver yang are often distending or throbbing in nature. The symptoms will typically occur suddenly and they will often be related to factors such as stress and emotional influences. Wind is an aspect of liver yang, so there will be an overlap between liver wind symptoms and signs and those seen when there is ascending liver yang. There is also a marked similarity between ascending liver yang and liver fire, with many of the symptoms and signs being the same. The difference between these two patterns is the presence of heat. The treatment of these two patterns with acupuncture is largely the same, but the herbal treatment will be different. Now let's go to its etiology. Ascending liver yang is never seen alone, but it will always be combined with other liver patterns of imbalance. It is correct to say that ascending liver yang has its root in a liver yin deficiency condition where the deficient liver yin is unable to control and anchor liver yang. It is important to keep in mind that liver blood is an aspect of liver yin. Therefore, the etiological factors that are relevant for both liver yin deficiency and liver blood deficiency can have relevance here. Liver yin deficiency evolving from a purely deficiency pattern to a deficiency excess pattern will require the presence of other factors that can cause liver yang to ascend, such as the consumption of substances that are warming or ascending in their energy, for example, alcohol and strong spices. Anger causes qi to rise upwards and can therefore be a relevant factor. Accumulation of stagnant qi in the liver, as in the case of liver qi stagnation, can force the liver yang to rise. This means that etiological factors such as frustration, irritation, and repressed emotions can also have relevance here. Stress is frustrating and can cause qi to stagnate. At the same time, being stressed is something that consumes kidney yin and thereby also liver yin. A vicious cycle can soon develop. When liver yang is excessive, it will consume and injure liver yin. The more deficient liver yin is, the less able it will be to control liver yang, which then becomes excessive. There is a big difference in how ascending liver yang imbalances manifest themselves, which depend on how deficient liver yin is and how excess liver yang is. For some clients, the liver yin is just too weak to anchor the liver yang. In others, liver yang is so excessive that it will require a very robust liver yin aspect to anchor it. There will usually be a clear dominance of ascending liver yang in younger clients due to their yin still being relatively strong and their liver yang becoming excessive due to their lifestyle and diet. Older people, on the other hand, tend to be more yin deficient, so there will be a greater deficiency aspect in their ascending liver yang condition. The difference between how much deficiency and excess there is will influence the treatment strategy. The more liver yin deficiency there is, the more focus there will be on the treatment in nourishing liver yin. Conversely, if ascending liver yang is the dominant aspect, there will be more focus on draining and controlling liver yang. Symptoms and signs. There will be hemilateral headaches that is throbbing in nature, pain behind the eyes. The pain will be throbbing or distending. There will be dizziness, tinnitus and deafness, irritability, aggression, quick temper and anger. There will be insomnia and the voice can have a shouting quality or have a harsh tone. There will also be muscles which are hard or tense. The eyes may appear fixed and staring. The tongue may have swollen sides, or red speckling along the sides, and the pulse will be wiry, especially on the left guan position. The key symptoms: headache, irritability, and a wiry pulse. And the treatment principle: we descend and control the ascendant liver yang. The acupuncture points to choose from are liver 3, Sanjiao 5, Li 4, gallbladder 20, gallbladder 21, Gib 38, gallbladder 43, Do 20, and bladder 18. And we use the draining needle technique. To further explain the choice of points, liver 3 descends liver yang and nourishes liver yin. Li4 in combination with liver 3 spreads liver qi and thereby soothes the liver. Sanjiao 5 drains liver yang, especially when symptoms are manifested in the Shaoyang channels. Gallbladder 28 and gallbladder 43 drain liver yang from the head, especially when the symptoms manifest in the gallbladder channel. GB20 drains liver yang from the head and calms liver wind. GB21 sends liver yang downwards. Do20 descends yang from the head. Bladder 18 calms the liver. The advice given for liver yin deficiency is also relevant here. It will be advisable for the person to avoid consuming substances that create heat in the liver or cause liver yang to rise. Alcohol will frequently have a negative impact, in particular red wine, as the sour taste will channel its effect directly to the liver. Anger causes qi to rise, so the person must try to avoid getting into situations where they can become angry. As described above, stress will also have a negative effect. Exercise and dynamic activities will activate and spread liver qi. This will reduce the pressure in the liver, which may have helped to force liver yang upwards. Ascending liver yang can be caused by liver yin deficiency, kidney yin deficiency, liver qi stagnation, and liver blood deficiency. In turn, this can result to liver yin deficiency, liver fire, and liver wind. So to summarize, hyperactivity of liver yang or ascendant liver yang has its etiology in prolonged anger, frustration, and resentment. Its underlying or accompanying pathology are kidney yin deficiency, liver yin deficiency, liver blood deficiency, and hypertension. The signs and symptoms: headache, which is temporal, behind the eyes or lateral side of the head. There will be dizziness, tinnitus, fire flush with baking heat in the face, deafness, blurred vision, dry mouth and throat, irritability, insomnia and profuse dreaming, feeling wound up and easily angered. The pulse will be wiry and fine. The tongue is normal or red, pale if liver blood deficiency is present. The treatment principle: we enrich the yin, calm liver, and subdue yang. For the acupuncture treatment, we use liver 3 to course liver qi and subdue yang, Sanjiao 5 to subdue yang to relieve headache, bladder 23 to supplement the kidney, spleen 6 to enrich kidney yin, pericardium 6 to calm the spirit for bad temper, gallbladder 43 to subdue yang to relieve headache, gallbladder 20 to subdue yang and for dizziness, liver 2 to clear liver fire, bladder 18 to enrich liver yin, kidney 3 to enrich kidney yin, and the extra point yang for heat in the liver, Li4 to subdue yang to relieve headache, gallbladder 38 to subdue yang to relieve headache, Sanjiao 17 with gallbladder 34 for tinnitus, and with needle with drainage. Thank you for your attention.
Let's talk about the inspection of a pale tongue and red tongue. The color of tongue. Under normal conditions, the body of the tongue is light red in color. There are 5 abnormal colors of the tongue. First is pale white. This is paler than the normal light red, more white than red, sometimes without red. It results from deficiency of both qi and blood, or depletion of yang qi, with loss of the motive force for blood flow. In both cases, blood is unable to flow upward and nourish the tongue. Thus, a pale tongue indicates an illness of deficiency or cold. A pale and small tongue suggests deficiency of both qi and blood. A pale, fat, and tender tongue suggests gradual decline of qi. As seen here in the photo, we have two different photos of pale tongues. So if the pale tongue is slightly red or bloodless color, and it is thin, small, pale, then its illness of deficiency or cold, it is also deficiency of both blood and qi. But if it is a pale tongue, slightly red or bloodless color, but plump and tender, then it may be a deficiency of yang qi. Now let's talk about the red tongue. A bright red color of the tongue develops when heat excites qi and blood so that they flow more vigorously. As blood fills the vessels to capacity, it also collects in the tongue and gives the tongue the red color. A red tongue indicates heat. If the tongue is red and rough or hairy and has a thick yellow coating, it suggests exogenous heat. If it is red, plump, and tender and has scant coating or fissured or smooth without coating, it suggests endogenous deficiency heat. Red in the tongue tip indicates strong fire in the heart. Red in the sides of the tongue, blazing fire in the liver. And red in the middle of the tongue, strong heat in the middle jiao. In this photograph, we see that the red is at the tip mostly of the tongue. So if we have a red tongue with redder than normal, and it is rough and red, hairy, thick, and yellow coating, the illness of heat, then it may be accumulation of heat dampness. If it is red tongue and tender and red, slight no coating or with fissures, then this may be due to heat due to yin deficiency. If it is a red tongue with the red tip and sides are red, then this means heart fire flaring up, liver and gallbladder fire. If the middle portion of the tongue is red, then this means strong heat in the middle jiao. Thank you for listening.
Let us now go to epigastric pain. The topic is phlegm fluids in the stomach. The clinical manifestations of phlegm fluids in the stomach is epigastric fullness and distension, nausea, vomiting of watery and frothy fluids, dry tongue and mouth without desire to drink, splashing sound in the stomach, feeling of fullness of the chest, loose stools, loss of weight, lethargy, dizziness, and dull frontal headache. The tongue will be swollen with a sticky coating, and the pulse will be deep, slippery, or wiry fine. Phlegm fluids are a form of phlegm, seen only in very chronic conditions and usually in old people. It is not a common pattern. They are characterized by expectoration or, in this case, vomiting of white, watery, and frothy fluids. The splashing sound in the epigastrium on movement is also a characteristic of phlegm fluids. All other symptoms and signs in this condition reflect phlegm. The dry mouth is due to the accumulation of fluids into phlegm fluids so that the normal fluids do not reach the mouth. The loss of weight, not normally associated with phlegm conditions, is due to the chronic dysfunction of stomach and the spleen. The treatment principle to be used is to resolve the phlegm, harmonize the stomach, and tonify the spleen. The points to be used are REN 10, REN 9, REN 12, stomach 36, bladder 20, stomach 40, and bladder 21, using the even method except for REN 12, stomach 36, and bladder 20, which should be reinforced to tonify the spleen. The explanation for the points is that REN 10 stimulates stomach qi to descend. REN 9 promotes the transformation of fluids to resolve the phlegm. REN 12, stomach 36, and bladder 20 tonify the spleen, and stomach 40 resolves phlegm, and bladder 21 regulates the stomach. As dietary advice, the patient should avoid eating too many cold energy foods and especially drinking iced drinks. Thank you so much for your attention.